Hello all, I'm Dr. Walter from SNS College of Physiotherapy. So today we are going to see a lecture video regarding meningitis. So today we are going to see the subject regarding the community medicine. So in our community, so these types of n number of cases are happening. So among that, I have taken meningitis for today's class. So hope you will be enjoying this class in this video. Okay. So what is meningitis? The common term which we use is cerebrospinal fever. Okay. So this meningitis itself, in this name itis, it is representing the inflammation. So where it is inflamed. So before that you might have seen this word meninge. So the meningeal area of both cerebral and the spinal area will go for the inflammation, and this will causes the meningitis. So what and all features that a patient will be having? First of all, we need to see about the headache. Constant of headache will be happening, and vomiting and also the nausea feeling will be happening in the first stage, and it will progress to the vomiting. Next, so these two categories are normal for each and every cases, a normal headache and normal vomiting, but it will arise along with the stiffness of the neck. The meningeal patient, that is a meningitis patient, will be having the stiff neck. So these types of causes will be encountering at the last stage, that is coma. It lead to a fatal, that is death. Okay, so these are the things which are happening in the meningitis. Now we will go inside something deeper. What type of bacteria which is responsible for this meningitis? Neisseria meningitis is a term which is most commonly used in the meningeal fever. So this type of will be having A, B, C and etc. categories. So commonly we will take Neisseria meningitis. So when we are going inside, the source of infection, basically the source of infection which we can see, it is a acute communicable disease. Communicable disease means it can spread. So acute stage means more or less it will spread or it may not spread. But the source of infection we need to remember, that is nasopharynx, the nasal area. Okay, so nasal area, how it is spreading out. So based on the age and gender, so age and gender we need to be very careful based on the ruling out of the certain diseases. So age and gender for children and infants, and both the gender, both male and the female, that is boy children and the female children will be encountering with the meningitis. Now entering into the immunity, the children who are less in immune level will occur with the meningitis. These things are most common in the upcoming childbirth. So nowadays India is a greater in population. So each and every day many thousands of childbirths are happening in the India, in the country itself. So among in India, how many children are going for complete good immune power and how many children are going for very low in immune power? We need to think about our community. Now, so these and all categories will be going for the epidemiological features. Now we are going for the mode of infection. So the mode of infection is nothing but the droplet infection, which we all know will be carried out through the nasopharynx. While we are sneezing, okay, while we are coughing, okay, while we are spitting out certain things. So these things will cause from the droplet of infection, and it will cause the acute communicable diseases. So how we can, the incubation period, we need to note it down. It is 3 to 4 days is a basic incubation period, which the infection, that is a Neisseria meningitis, will be growing inside, and then it will exhibit certain things that we have seen already, that is a headache, vomiting and the stiffness of the neck. Now this incubated period, the bacteria will grow inside and then it will envelop into the meningitis. Now prevention and control. As a physiotherapist, when we are dealing with a community area which is more common with meningitis, we need to be very careful about these things. So as a healthcare worker and also a physiotherapist, we need to be very careful, and it is our responsibility to create the awareness and also preventing and also the control. Prevention and control can be caused with close contact. If a children is having a meningitis, and the acute communicable disease will transfer to the mother, father and other children and other people also, and the nearby children. So it is very we need to make very ensure about the close contact relationship. If we should not isolate the meningitis, but we need to take care like putting up the mask, okay, so cleaning up the utensils and keeping separate utensils for these meningitis babies and children's. So these types of care and prevention should be upgraded. Going for the control, it is a vaccine which is called polysaccharide vaccine. This vaccine will be helping out to rule out and to cure the meningitis. So coming to the meningitis patients, so many of the people will be less aware about the meningitis, commonly called as a brain fever, and these and all things are more commonly will be less aware. So it is our responsibility as a healthcare worker to create awareness and to control the patients. So thank you, and we'll meet on next video.